Hi, I'm Dr. Divina Lopez, a board-certified pediatrician with over 10 years of experience in pediatrics, and you are listening to Dancing into Parenthood. Hello, this is Dr. Divina Lopez, and you're listening to Dancing into Parenthood. And today we have Miss Julissa Gonzalez. She's my friend from, believe it or not, elementary school. And I'm really proud of her because she approached me to do this podcast since it's February and it's actually
It's Children's Dental Awareness Month.
Right, but she works with adults, and she noticed that many of her patients who are pregnant have no idea about how to take care of their oral hygiene. So she has over 15 years of dental experience, and she's a dental hygienist. She studied at New York City College of Technology, and she practices in New York City. So, I mean, all the stuff that she was like showing me, I had no idea when I was pregnant, and I wish I actually did, because one of the major things that I was really surprised to read was how if you don't have good oral health during your pregnancy, you can actually go into preterm labor. Like, I had no clue about this, and I'm sure many pregnant women have no idea about this, because I don't even think that OBGYNs are notifying their patients about this, or even if the dentists are, because I don't remember my own dentist telling me about this.
I think part of it is that now we're becoming more aware of the link of oral health and your overall health body-wise. Mm-hmm. So there have been some studies that have been conducted that show patients, especially expectant moms, mm-hmm. when you already have an existing condition, you have a lot of plaque buildup, gingivitis, periodontal disease. They've seen, studies have shown those moms, expectant moms, mm-hmm. they are showing, they have a higher rate of preterm labor, low birth weight babies. So some studies have been conducted, and it shows the link. Just because part of it is, we all have plaque in our mouths. Mm-hmm. And our job when we go home is to remove the plaque adequately. So you want to keep those plaque levels down. Mm-hmm. So when those plaque levels are not kept down, it leads to gingivitis. Gingivitis is an inflammation of the gums. Mm-hmm. And when those levels of plaque increases in pregnant moms, especially because their hormones are already raised because of the pregnancy, they're showing that, I can never say this word, so excuse me if I'm saying it wrong, the inflammation of the gums can lead to an increased production of prostaglandins.
The prostaglandins.
Prostaglandins, mm-hmm. which pregnant moms, if you know, it's a chemical compound that induces labor. Mm-hmm. So, and too much of this chemical can actually induce labor. And then if you're having a preterm baby, it kind of comes hand to hand. You're going to have a low birth baby. So they're realizing we got to get pregnant moms into the dentist, and some of them more frequently than we come in twice a year, every 6 months.
Right.
So some patients, I've even put some patients and recommended that they come for every 3 months.
During the pregnancy.
Okay. And especially if you're breastfeeding afterward, mm-hmm. we pass on those germs to our kids.
Right.
A lot of moms don't realize the germs in our oral cavity, mm-hmm. we pass it on to kids. Mm-hmm. So I've seen it. Grew up in a household, the baby's bottle or whatever falls in the mouth, we put it in our mouth to clean it, and you give it back to the kid.
Right, or the pacifier. I've seen that a lot. Uh-huh.
So when you do that, you're actually transferring your germs to the baby. Mm-hmm. And if you're a high risk person, if your oral hygiene isn't up to par, mm-hmm. you're passing that on to your kid.
Right.
And people don't know, but cavities are contagious.
Okay.
Yes. So, of course, there's a whole science behind it. Mm-hmm. But basically, you don't want to share spoons. You don't want to clean your baby's drop-in bottle, binky, whatever. Mm-hmm. You don't want to clean it with your saliva.
Right.
And then give it to your baby.
Right.
Because you're just passing on those germs to your baby.
Right.
So that's something that I learned. And I was like, it's so easy for everybody to share, especially with a baby. You just, what's going wrong with that?
What about, kissing the baby?
Yes, you don't want to kiss a baby in the mouth.
Uh-huh.
And I think a lot of literature is coming out with that.
Mm-hmm.
You know, people do it. You don't want to do it because you inoculate the baby.
Yeah. I usually tell people, like, you kiss the feet of the baby.
The feet, the head.
But sometimes they even put their feet in their mouths, right? So it's like,
Yeah.
okay, you got to really be careful because by 5 months, babies are usually starting to bring up their feet and, you know, putting them into the mouth. But, yeah, I never really thought about that.
Yeah, germs. I mean, especially now we're becoming very germ conscious. I think with all the viruses and flu season, and now we have the coronavirus.
Yeah.
So I think people are becoming a little more conscious about, you know, where they're putting in, because your mouth is one of the biggest cavities in your body, and that's a port of entry, you know, nose, mouth, eyes.
Mm-hmm.
So if we could keep things at bay, I think that's kind of the rule of thumb.
Mm-hmm.
So, back to expectant moms, you want to keep the plaque level in your mouth down.
Mm-hmm.
Another thing I've noticed speaking to my patients who are pregnant, morning sickness kind of comes with the territory.
Right.
So our saliva in our mouth is a buffer.
Mm-hmm.
It helps us digest food. It actually cleans your teeth.
Mm-hmm.
It keeps the oral cavity moist.
Mm-hmm.
And after you vomit, the acid level in your mouth increases. So, of course, naturally, after you vomit, you want to go brush your teeth.
Right.
We're actually telling pregnant moms, don't brush your teeth immediately after, because the saliva in your mouth is still acidic. And basically what you're doing is you're spreading that saliva all over your mouth. And as we all know, acid weakens enamel.
Right.
Same thing when you have a high citric diet. People who drink a lot of orange juice. Some people eat lemons. You weaken the enamel.
Okay.
So basically, after you vomit, you're spreading that all around. You're weakening your enamel.
Okay.
We want you to wait at least 30 minutes. That's how long it takes for your saliva to come back to a buffer state.
Okay.
And then you can brush your teeth. Some women have really bad morning sickness and they don't want to walk around. Just rinse out with regular water. If you have extreme levels of vomiting, put a little baking soda in the water, because that neutralizes the acid in your mouth.
Okay.
So that's an idea.
So just like swish with that?
Yeah,
and then
swish with
spit?
it. Yeah, spit and rinse. And just,
Okay.
water will do the trick. But if you feel like you're, some people have extreme vomiting and morning sickness.
Yeah.
And then there are cases where you're actually weakening the enamel. We can actually see the wear on the inside of your mouth from the dentition. Wow. You start to wear the enamel, and then if you have any old fillings in your mouth, those fillings become raised in your mouth and the tooth, because you're wearing down the enamel. So that's usually a telltale sign of something that's going on. You will see this also in patients that have GERD, acid reflux. These are things we see also, and it's all because of the acid in our mouth. Okay. Another thing that I've noticed with my pregnant patients or expectant moms is that their gums are bleeding. It's normal. It's because the hormone levels are increased, and that's your body's response. So sometimes some people, they see that blood or that redness, and then they don't want to brush their teeth at all.
Right.
And it's like, you don't want to do that. Brush your teeth. Some patients even said when they're pregnant, brushing their teeth actually makes them gag.
Yeah.
If this happens, and it does happen, get a child-sized toothbrush because it's smaller, and just take your time brushing your teeth.
Right.
Sometimes in the morning we're rushing, blah, 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 and then you trigger that gag reflex.
Right.
Get a child-sized toothbrush, brush your teeth slowly, and in some cases, change your toothpaste, because sometimes the mint, some people have an adverse effect to the mint, makes them gag.
Right.
There's a lot of, you could switch to a children's toothpaste,
Yeah.
which isn't a bad idea because of the fluoride in it. And it kind of is going to remineralize your teeth,
Right.
which kind of offsets the acid that was in your mouth from the vomiting.
Oh, okay. That's a good tip.
Another thing also with expectant moms, sometimes dental procedures, emergencies happen. It is totally safe to get emergency treatment. You can, of course we need clearance from your OBGYN. You can still get anesthesia. We more than likely would use anesthesia without epinephrine, without the epi. You can take x-rays. It's a misconception. I'm pregnant, I can't take x-rays. You can.
Have the shield.
We have the shield.
Right.
It will cover your abdomen and your thyroid. And like I said, Cleanings are totally routine, normal, anytime after your second trimester, just because things are more stable then. For some people, not all, you're not feeling sick all the time.
You're feeling better usually.
You're feeling better, exactly. Keep your routine checkups. If you feel your gums are red and puffy and inflamed, come more frequent. And of course, if you have a toothache, you want to get that taken care of. If you have an infection and you need an extraction, that's things that your doctor would want you to take care of, because a tooth infection, things like that, can lead to an infection that
you become septic.
Exactly. Right. It goes into your blood system, and then that's going to lead to a whole nother problems. Another thing that was brought up to me by a patient was she was scared she was going to lose a tooth. And she's like, I heard with every pregnancy you lose a tooth. That's a misconception.
That's a myth.
That is an old wives' tale. Yes, there have been cases, pregnant women, their teeth do get a little loose, and that's because the ligaments and the hormones, after their pregnancy, everything will tighten back up. But your tooth, if you feel your tooth is loose to the point that it's gonna fall out, that just means you had something going on prior. So another recommendation I have for my patients, if you're planning on getting pregnant, make sure all dental work that you have, if you have any bridges and crowns and things like that you want to, that you're in the middle of, try to take care of all that actually before you become pregnant. And like I said, elective things, teeth whitening, veneers, those cosmetic things, you want to wait till after your pregnancy to do things like that. You don't want to do them during your pregnancy, because most dentists won't even do it, just because it's a risk for yourself. You don't want to take that type of risk when you're pregnant.
I have a question, because you said the when the plaque levels rise is when you're more at risk of having like this preterm labor. So what do people need to do in order to take care of their plaque levels?
Just regular brushing and flossing. Make sure you're brushing your teeth with, if you're using a manual toothbrush, you're using a soft toothbrush. Actually, everyone should be using a soft toothbrush. You shouldn't be using a hard or medium. And you're flossing. When you're brushing your teeth, a toothbrush only can reach the outer surfaces of your teeth. The interproximal surfaces, which are the surfaces in between your teeth, that's where, plaque accumulates. And also with your toothbrush can only get so far. So you want to incorporate the brush, floss, and rinse method. You want to brush your teeth for 2 minutes, all sides of your teeth. You want to floss in between your teeth, and make sure you're flossing adequately. There's YouTube videos that will show you the proper way of flossing, which is the C formation. You want to, like, when you bring the floss down, you want to hug your tooth and slide down with the anatomy of the tooth. You can reach down further, and you're actually removing the plaque that sits at that gum margin. And then you want to rinse with a mouthwash. You don't want to use a cosmetic mouthwash, which is a mouthwash that's scope, things that are just basically to freshen your breath. You want to use a mouthwash that has essential oils in it. That's what you want to use. A mouthwash that not so much is medicinal. I don't know about name brands. This is not a paid sponsorship by Listerine. But or Skull or Colgate, but you want to use like a Listerine Total Care, things like that. Read labels. Like a lot of patients ask me, what do you prefer? Everyone has a personal preference, but do use a mouthwash that has the essential oils in it. And you don't want to use a cosmetic mouthwash, because those just freshen your breath. They don't do anything,
the job
and
of
nothing for you per se. Any other questions?
I guess. I know you don't want to mention brands, but because I didn't even realize there were like essential oils in the mouthwashes. I had no idea. Okay, so are there like any organic? Because everybody loves the organic, natural route. So are there
the essential oils are all organic per se, because they're the essential oils. If any of my professors hear me right now, I can't remember the essential oils off the top of my head. So you have a bottle of Listerine somewhere? But I know it's eucalyptus oil. What else is in there?
I know some people even like do something with coconut oil where they clean their teeth
that's
with
the
that.
pulling.
The pulling, yes.
The
yeah,
pulling.
yeah.
I personally have not tried it just because I can't hold anything in my mouth for. I think you have to hold like pure coconut oil in your mouth for like 2 minutes or something.
Okay.
Which to me is a long time
yeah.
to hold something in your mouth. But I've heard people that have used it and they have had great results. Like I said, I personally haven't tried it.
Right.
So usually when I recommend things to my patients, I usually like to recommend things that I have actually tried.
Yeah, so that you know whether
so I know exactly,
yeah.
you know, their results. And then also with that, the results I got can be different from what another person would get. I know some people are now into the whole charcoal thing.
Yes, I was going to ask you that too. Yeah.
I actually... As far as the charcoal, I did get a toothbrush that was infused with charcoal. There was no difference. There was no difference.
Yeah, you gotta be careful because you know everything is a business and people are trying to make money. So you have to make sure that you're not just falling into the trap of buying something for the sake of it because it's trendy and you know everybody else is doing it.
And that's the thing. Cool. Everybody wants to. Who doesn't want fresher breath, whiter teeth? And that seems to be the consensus now. Everybody wants these.
Plus, I think, you know, when you're pregnant, you want to make sure that you're really taking care of yourself. Exactly. So you'll go ahead and spend the extra money because you want to keep your baby safe and you want to keep yourself as healthy as possible to take care of the baby. So, you know, it's always good to know.
And always check. And like one thing we always check with your OB and let them know, be completely transparent what you're doing at home. Yeah. Because some patients, they'll come in, oh yeah, I'm doing this and doing that. And then reality, they're not. Just be transparent with us. Let us know so we can help you because this is an exciting time. And I know for some people are very anxious, you know, you're nervous and there's a lot of things. So as much as information we like to give you, you also have to give us. So if you have any questions, you know, and they're not silly questions, just jot them down. And when you come in, just ask us. Like, I know I want my patients to feel comfortable when they're in the chair, especially the expectant moms. You know, we try to make it as comfortable as possible. Most dental offices, our chairs recline. Right. So some patients can't recline all the way back. You know, we can sit you up for it. And I had a patient, she was a little reluctant. She didn't, because she was like, oh, anything in my mouth is gonna set off my, you know, me throwing up. And I was like, we'll work together. Right. What we need to do to get you out of this, you know? Yeah. Even if we have to do the procedure, you know, gently, we'll schedule that extra time for you. Just because we want you to be as healthy as you can be. Right. You know, so your teeth, not that they should be the last thing you worry about, but should be the least of your worries during your pregnancy. Right. Because it's important and like everything is, you know, together. And like if you read the literature, it's like 30% of pregnant women will experience different levels of gingivitis during their pregnancy. 30%, that's a lot. That is a lot, yeah. That's a lot of women. And then especially, I think, like you said, you didn't know this. So let's shed some light on it. That way it becomes part of the norm and people know, okay, you know, you're pregnant, you should set up an appointment with your hygienist, get a cleaning, and just so you could get that base level of where you're at, where you need to stay throughout your pregnancy, just to make things more comfortable. Yeah, I think that's good information. Thank you for sharing that. Thank you. I know everybody's going to appreciate it. Especially because, like I said, even I myself had no idea, and I don't remember my dentist or my OBGYN like telling me any of this stuff during my pregnancy. So I'm happy that you volunteered to do this podcast, and I'm sure that the listeners would appreciate it too. If people wanted to reach out to you, where can they find you? Actually, I do have an Instagram page. It's called Juju Smiles. Aww. It's on Instagram. That's my nickname. You know my nickname. You could DM me. You could send me a message, and I will get back to you. Okay. Just keep in mind this page is new. It's a baby itself. Yeah. It's something I have been working on, and like I said, it's a baby for me. Yeah, it's where you're going to be putting out advice. I'll post advice and things, but like I said, this is not a substitute. You still have to go to your dentist. Course. Yeah. But yeah, anyone has a question, just shoot me a DM at Juju Smiles. Also, my email address is jujusmiles@gmail.com. You could email me, shoot me an email if you have a question, and I will try to help you as best as I can. Also, a lot of this information, you could go on the ADA's website, and I believe there's a tab in the bottom for expectant moms, and you could go on
that's
there.
A good resource. Okay.
And the ADA is American Dental Association. You could go on to there, and it'll kind of reiterate all the information I passed on today.
Perfect. Well, thank you so much, Julissa. This was fun.
That's on our second take.
All right, everybody. I hope you enjoyed it. If you have any questions for Julissa and you want to pass them on to me, you can always do that. You know where to find me, Dr. Divina Lopez on Instagram. And I will definitely pass it along for you if you can't find her. But she is Juju Smiles, right, with an S?
Yes.
It's JUJUSMILES on Instagram, right?
Yes.
Okay, thank you.
Bye.
Bye. To listen to more podcasts, please visit us at drdivinalopez.com and follow us on Instagram at Dr. Divina Lopez. Thank you for listening. Please keep in mind that all advice given in this podcast is general information. To understand your specific situation, you must consult with your pediatrician.